Hi, my name is Andrew Poveda, and this is AP Med, a podcast to display the stories of people in medicine with diverse stories. Here we have an honorary guest, Dr. Michael Sbarra, an OBGYN. Now, do you want to introduce yourself?
I will. Hello, my name is Dr. Michael Sbarra. I am from Belleville, New Jersey. I grew up there. I attended number 5 school and then Belleville High School. And after that, I attended Newark State College, which is now known as Kean College of New Jersey. And then I attended medical school at the University of Florence in Italy. And I graduated from the University of Bologna, however. After that, I took a residency in OBGYN at St. Michael's in Newark. So following that, I became a practicing OBGYN in Hackensack, New Jersey from 1991 until my retirement in 2021. At that time, I had my own private practice. And during the last 15 years of my life at Hackensack, I was the chief of gynecology and I was in charge of or clerkship director for the medical students from St. George's University in the Caribbean. And I also taught the students from Rutgers Medical School. In addition to that, in my clinical work, because this work was done in the classroom, I worked with the students from Rutgers residency and Rutgers Medical School.
Great answer, great answer. My first question was actually gonna be, tell me about yourself, but it seems like you've covered everything.
I thought that was the tell me about yourself question. Okay.
Yeah, yeah. Whenever I'm doing an interview, the tell me about yourself question, it really gets a lot of people. How would you tell pre-meds how to format their answer? Like in your case, you just did a very long answer and you covered a lot of what you've done. So how would you tell people freshly applying to medical school how to format their tell me about yourself? Because it's in every interview.
Correct. That is in every interview, but I say just try to be as natural as possible because as an individual who has interviewed many people entering residency and medical school as well, they all come in with questions that they think we're going to ask. So most of them sounds like they are. They're all pre-prepared answers. So
Yeah.
we can pick up on that quickly. So try to be as natural as possible, kind of understand what the questions are, and don't have a prepared answer that you sound very robotic. We
Mm,
pick up on that right away.
okay. But you know what they also say? If you sound rehearsed, that means
Yes.
you haven't rehearsed enough. So
Yeah.
you need to
So
know a little bit about yourself too. Don't just wing it. Don't take
that's an
that as
excellent point.
yeah. Okay. Can you describe your background and where you come from?
I'm Catholic, and my ethnicity is born in the United States, but my family history is from Italy, so Italian by nature,
Mhm.
uh, which in the 1960s, the majority of people in Belleville, New Jersey were of that
So,
nationality and religion.
can you describe how your background has affected you?
I think my background of growing up in the 60s, like anyone else
Hmm.
who has pursued professional pathways or any other pathway, uh, we were a boots on the ground type generation. There was no internet, there was no mobile phones. It was a whole different world. So it was kind of, you were thrown in the trenches and you learned to get along.
Hmm. Okay. I like that answer. A lot of people from older generations they speak more about their work ethic and how this generation isn't as willing to do the work. So I like that you're putting some emphasis on that and that you really do have to work hard. Yeah.
Yeah, hard work, be on time, uh, be present, and act respectful of other people.
Mm.
So punctuality and respect.
Good answer. Good answer. And now for the first question, I'm gonna ask you. I'm gonna follow up, and I'm gonna ask you this question at the very end, and I'm gonna see how your answer changes.
Okay.
So, why medicine?
I think most of the reason reason most people choose medicine is they like the challenge and the unknown also. Like you want to know what's happening, and it's the unknown. So there's the old story of when you're growing up and you're walking down the street and you see a police car and an ambulance and there's a crowd around and you're outside of the crowd and you want to know what's happening, what's going on, what's the unknown. I want to be involved. Or you see a TV show and you see doctors and surgeons, they enter a room and the doors close. It's what's going on. So I think it's the unknown.
I like that answer. I never thought of surgeons and people behind closed doors. Like people always say that you never know what's behind a closed door, but I never thought in the context of a surgeon performing surgery. That's a very good point.
Or just what they know, yeah, right?
Yeah, so. Exactly, yeah. Out of everybody in your life, who are you most thankful for?
Absolutely my wife, beyond the shadow of a doubt. I would not be where I was without her by my side. I met her in 1973, so we're together for 52 years, and we've been married for 47 of them.
Oh, wow. How did you meet her?
How did I meet her? My cousin married her cousin, and we were partners in the wedding.
Oh, wow. Okay, that's nice. That's cool, yeah.
Okay. So that was the week that I graduated from Belleville High.
Oh, wow. Wait, so you're high school sweethearts?
No, she went to a different high school.
No, but you still got together in high school.
No, I just graduated high school. She was still in high school.
I mean, it counts. It counts. Like it's close enough. Okay. Close enough, right?
All right.
Yeah. What's 1 week compared to how many years you said you were together for? Since 1970.
52.
52. Yeah. What's 1 week compared to 52 years?
Yep. But... She went to Lyndhurst High.
Lyndhurst. Okay. Yeah, it's pretty close.
Yeah.
Yeah. Medicine is known for passing down knowledge. Who do you hope to give back to, and how has your work impacted others?
Well, people I hope to give back to are people like yourself, people that are going to see this podcast, and others that are involved in high school organizations preparing for medicine, people in college, and also was the students that I taught during my clinical years.
Could you
as well as residents?
Okay. Could you touch more upon your clinical years and your experience in teaching at Rutgers, New Jersey Medical School, and during your program? Sorry.
Okay, so most of so when you are an attending physician and you're teaching medical students and residents, you are really in the hospital setting. That's for what's called clinical work. So you have obstetrics, surgery, internal medicine, pediatric, psychiatry, and emergency medicine. Those are what's called the 6 cores. Now, the first 2 years of medical school, anatomy, physiology, biochemistry, and pharmacology, they're taught in the campus, and they're usually taught by PhD people, and they're taught in large classrooms, as you probably are in now. So clinical work is done in the hospital. So there's 2 types of work that I did with the students and the residents. So with the residents, it was mostly making rounds with them in the morning and taking them to the operating room and teaching them to operate. So actually, they'd be the pilot, I'd be the co-pilot, guarding them along. The medical students was the same, but in addition to that, we had small classrooms with anywhere between 10 and 20 individuals, and I'd sit with them for 2 hours, 3 times a week.
2 hours, 3 times a week. Okay, so like college kind of.
Everyone did that. That was me. And so I did that more once I was retired from clinical practice. I had a disability, which I was unable to operate anymore. So from 2014 till 2021, I was just focused on teaching the students and the residents and administrative work as chief of gynecology. So my clinical work, I had to close my office in 2014 due to an injury to my radial nerve, which prevented me from operating or examining patients.
So you had your So what you're saying is you had your own office, your own practice, and then
Correct.
you had
I
to
have
shut
my
it
own
down?
practice.
Oh, okay.
Yes.
Where was it located?
It's in Hackensack.
Oh, it was in Hackensack. Okay. All right. On to the next question. What made you choose the specialty you wanted to choose?
I chose my specialty obstetrics and gynecology, like a lot of my contemporaries did, because it focuses on primary care medicine as well as surgery. And you also have deliveries of babies. You take care of women during pregnancy. So when a woman is pregnant, uh, she'll have medical problems. So that really falls into our realm.
Mm,
So that's why we practice medicine as well as obstetrics, and surgery is a big part, gynecologic surgery. And women come to a gynecologist usually every year for an annual visit. So that's how we get to practice primary care medicine also, because they'll come in with issues like urinary tract infections, pelvic pain, headaches, menopause. So we take care of upper respiratory tract infections, and the list goes on. So we get to see that in medicine, and we get to operate for gynecological reasons. So it's a great mix of both having a stethoscope in one hand and having a scalpel in the other hand.
mm. All right. What's one thing you would tell people to convince them to choose OBGYN as a specialty?
I wouldn't try to convince anyone to do it as a specialty.
No?
Um, what usually happens is once you start your clinical rotations as a medical student, which you will be there pretty soon.
Mm,
So in your third year, then you'll be in the hospital and you'll do those 6 core rotations, as I said, during your third year. And that's where you'll kind of decide what you want to do. I had many students that came into my rotation that wanted to go into psychiatry or anesthesia or surgery.
mm-hmm.
And that's when they decided I want to go into obstetrics and gynecology, because they saw it's a lot different than an internal medicine field or some other field.
So for people that
It's
think, oh, sorry,
it's
are you not finished with your answer? Sorry.
it's very dynamic.
Okay, yeah. So what would you say to people that are interested in OBGYN, like in high school or even in college? What do you see in OBGYN residents and physicians that, like, what characteristics do they have? How do these pre-meds model themselves to become an OBGYN? I know you said it's dynamic, but
Yeah,
what's like one common trait like you see among OBGYNs?
right. So our daily day is dynamic. So they're really people that are go-getters. They're involved. They're engaged with everything.
Mm-hmm.
Because our typical day, we wake up, we make rounds, and then in OB we do some circumcisions. We may go to the operating room, and then we go to the clinic. Then maybe there's a couple of lectures. Then there's deliveries during the day. So it's very involved. Whereas other specialties, they're very didactic and academic, where we do have didactics and academic, but it's very involved. And surgery is the same way as well. So a surgical specialty as opposed to a non-surgical specialty are two different entities. And you'll see which people go into each one. For example, the people that go into non-surgical specialties are really uh, academicians at heart, and people that aren't,
Mm-hmm.
uh, people that are really engaged in the ongoings of the day.
All right. And for clarity, could you say what didactic means, just in case people who don't know?
Didactic means really academically oriented. So they're involved in the theory. Not that everyone else isn't, but that's their main objective, is the theory. Um, so, for example, if you went to internal medicine rounds in the morning, they speak about the patients they admitted during the night, and somebody had, for example, microscopic hematuria, and then for the next 2 hours, they're discussing microscopic hematuria. Whereas if you're in a surgical field, You went through the patients line by line, a couple minutes each,
Yeah.
and then you went about your work, either operating or doing consults in the emergency room. And then at the end of the day or during your weekly academic sessions, you discuss that.
Okay, so didactic means
Pertinent.
to follow up on a case, to be more in depth in the case compared to, like you said, surgery or going in 5 minutes in, 5 minutes out.
Right. And then we'll talk about it later because we have work to do during the day. Not that the
Okay.
people don't, but that is their focus because they're really academicians and they cover such a wide specialty. So, there's a saying that the people in primary care, internal medicine, they learn less and less about more and more, and the specialist learns more and more about less and less.
Okay.
That's a key statement. That says it all.
Yeah, it makes it very clear, like the clarity from that statement. Okay, back to what you were saying before.
Hopefully nobody listens to this that their parents is an internist or something and says I made negative comment.
Oh, I actually do want to do internal medicine myself, so I don't I don't take it harshly or anything. And from what you were saying, I understand what you were trying to say. Yeah.
Yeah.
And but yeah, back
And then
to
after internal medicine, someone like yourself, I want to do internal medicine. So when you're doing that, you're going to go through all the other, subspecialties like gastroenterology, cardiology, nephrology, endocrinology, and that's where you may take an interest in one of those, and that's where your path is going to split at that time during usually your third or fourth year of medical school.
Right.
So this gets back to what we alluded to earlier, how which path are you going to take? So you may think you have one path, and then it's going to change.
That's true. You don't really.
Well, you're an educated person. You really want to delve into problems and understand why, and then you're going to see how interesting all these other subspecialties are. So what happens is then you go into what's called a fellowship. So you do 3 years of internal medicine, and then if you go into cardiology, it's 3 years of cardiology, and then it's a couple years for gastroenterology, and so on and so forth.
All right. Yeah, because a lot of people like to say, especially even as early as high school, people say they want to be a doctor, and then they say, "Oh, I want to be a pediatrician," or "I want to be an anesthesiologist." But like you just said, you don't really know until you're in your third and fourth years where you're doing clinical rotations.
And some people get focused on that. So
Yeah, just have an open mindset heading into medical school is what you're trying to say.
Yeah.
Yeah.
It is.
Okay.
Oh, you said it better than me, so you should be on this end.
No, I shouldn't. But thank you. Oh yeah, back to what you were saying about how you got into teaching to teaching medical students.
Right.
Do you think you would have gotten into teaching if you didn't have your injury? Because you said after you got injured is when you got into teaching, right?
No, I'm sorry. Maybe you misinterpreted or I misspoke. That's when I focused most of my work on teaching, but I was involved in teaching when I was a resident. So when I was a resident at St. Michael's, not all residents like to teach. So I like to teach, and I taught them in the operating room and in the clinic, and then I usually met with them for an hour a day to go over, certain cases. Like we talked about what they do in medicine in the morning. They talk about a case or a disease. That's what we did every day. We'd speak about one of the interesting cases for the day. So I've been doing that since I was a resident. So because I was involved, once I started working in the hospital and there were students there, once again, I was one of the few attendings that was willing to take time out of his private practice, which we'll get into later on about that, to actually teach the students in a classroom. And by classroom, I mean there's 5 to 10 or 15 students that you're sitting with each day or a couple times a week. So that's when it started. So then, because I was one of the few that taught students along the way, and I taught it was mainly the Rutgers medical students at that time. So when St. George's Medical School got an affiliation with Hackensack, and we became one of the major teaching facilities, I was appointed as the clerkship director for OBGYN, which meant I was the director for all the OBGYN students. So I had 6 students every 8 weeks for the whole year, so I had 48 students a year.
And as a director, you would be with them during rotations, and you'd also be teaching them, correct?
Correct.
Okay, yeah. Because I would, besides,
Most doctors would just direct, but now a lot of them teach also. So you'd be in charge for implementing the program, the structure, the courses, what they're going to do, how you're going to break the students up, who you're going to place them with. So, for example, in OBGYN, I had 6 students every 6 weeks. I'm sorry, I said 8 weeks, every 6 weeks. And I put one on the obstetric service, one on gynecology service, one in the operating room for gynecology, one on high-risk medicine, and one on outpatient clinic. So they were divided. They each did 1 week at each different level. And then I met with them every day as well.
Okay, all right. That's good to hear. I need more clarity on that one.
Okay.
Yeah, you said
That's what I was looking at.
You wanted to talk about your private practice as well. So I don't. Let's go on to that right now. Actually, how
Okay.
did you go about starting that up? Because that's a whole type of business format as well that you have to consider.
You are correct. It is a business, and that's one of the things the students used to want me to teach about, the business of medicine. However, the paradigm of medicine has switched. So back in the 50s, 60s, 70s, and 80s, and late 80s, early 90s, when I started my private practice, that was the only way. Everyone's goal that went to med school was to have a private practice. There wasn't many opportunities to work in a hospital. It just academically, financially, it didn't benefit the hospitals. But now the whole paradigm has changed, so everyone is gearing towards hospital work. In fact, about 85% of people graduating residencies are going to go work for a hospital corporation or a hospital complex. So the private practice where you're going to graduate and put a shingle out, that doesn't exist anymore.
And why do you think that changed? The whole dynamic flipped.
I think it had to do with cultural change, as well as insurance changes, reimbursements, things of that nature. So now most people are employed by a hospital, which is, I think it's a positive, because now it creates a less stressful, better environment for the physician, which is then transmitted to the patient. So, for example, when I had a private practice, you're by yourself, you're on call 24/7, and to take a vacation, it's you have to take vacation. Some people say, well, you're going to be away when I'm going to have a baby, you're going to be away. It's kind of stressful because you're running a business. It's like having a store, right? You can't own, an ice cream store somewhere. I'm going to be closed on the weekend, or I'm going to close for 2 weeks in the summer. Yeah. It's not going to work. So now with the hospital, people are employed by the hospitals. And now once you get out of residency, now you're looking at a 40-hour work week, which is averaged over the whole month. So instead of 24/7 putting in all those hours, you have a 40-hour work week. You have 6 weeks vacation. You don't have the stress of overhead and paying bills. And when you go home at night, you're home. Your beeper's not going off because there's people that are in a hospital taking care of whatever happens. So when you have that 40-hour work week, maybe you have 3 days where you're in the clinic, 1 day where you're operating, and 1 day where you're on call during the night. So you'll be handling all the surgeries, the consults, and the deliveries. Or if you're in another specialty, you'll be handling all the emergency room visits and all the emergency procedures that need to be done.
Okay. And oh yeah, back to
I'd like to sign up for that right now.
You think it's a lot different and easier now compared to before? Is what you're trying to say?
I don't want to ever say easier because everyone, really works hard, but knowing you have a shift that begins and a shift that ends, you don't have the overhead responsibility that weighs heavily on everyone is paying those bills at the month. And then, being on call 24/7 and having to answer calls at all time, the night, a day, which we did voluntarily, not voluntarily, it was part of our work. We did it and we thought nothing of it until you look back and you see how things change.
Yeah,
But
yeah.
I am sure they did change for the better for both physicians and patients.
Okay. Yeah, it's like, let me say a simple example. You graduate, like, let's say high school, and then there's so many more upgrades now, or they added so many more things. Like, it's so much, not easy. Easier is definitely not the word, but it's so much more different compared to what it was before. Yeah.
There's more opportunities and avenues to take.
Definitely. Yeah.
Okay, so in my day, there was only one avenue. Finish and start a private practice. Take out a loan, put a shingle out, and that's the way. That does not happen anymore.
Okay.
Very rarely it does.
Yeah, there's a really, because I do see some private practices, but yeah, like you said.
They still exist, but they were in existence for a while.
Yeah. Okay.
Or if you do see a shingle out there, they're probably run by the hospital, because a lot of offices that you may see in the Belleville or Nutley area, you'll see the sign there, but they're really owned by the hospital.
Oh wow, I did not know that. Do they have some type
Not
of
all of them, but
do they have some type of branding where it says sponsored or not sponsored? What would the word be? But
well, for Hackensack, they'll usually have the little Hackensack logo. So, but a lot of times you won't know that.
Okay, well, yeah, that's the more you know. I did not know about that at all. Yeah. Okay. What do you say to those who romanticize medicine as a career and to the people who end up leaving medicine?
First of all, in my day, medicine was a calling. It wasn't a career. It was actually your life calling. And yes, it did turn out to be a career in medicine. I would never discourage anybody. As I said, the whole paradigm has shifted to, hospital employees.
But now that you're retired from a clinical practice, a clinical setting, do you feel accomplished in your work? If it is a very blunt question, I don't know if blunt's the exact word to describe it, but how do you feel now that you're quote unquote done?
Yeah, I do feel accomplished because in my private life, for my specialty, OBGYN, I deliver a lot of babies, right? I constantly run into former patients or people that I have delivered who were babies and now they're grown adults. I run into students all the time. And now with social media, Facebook, I do stay in contact with a lot of former students. And I'm proud to see their accomplishments and give them all their accolades. So I feel very accomplished in that sense.
Okay.
And no matter how many times I run into someone that I delivered, and they'll run up to me and hug me and thank me, and it's a great part of this field where you don't get that in many other specialties.
Yeah, that's a very soft spoken thing to say about OBGYN as a whole career. Yeah. Have you ever felt like you've dealt with imposter syndrome?
I don't fully understand imposter syndrome.
You don't know exactly what imposter syndrome means?
No, give me an example.
So imposter syndrome is where you feel like you don't belong in a room. Like you feel like, let's say, you feel like everyone around you is smarter than you, or they're more talented than you per se, and that you don't belong in there.
I really haven't had many occasions where I did feel like that. But I was also a speaker for a lot of pharmaceutical companies. And I did most of my speaking engagements in New York and New Jersey, but sometimes they sent me to Massachusetts, and I had to speak to a lot of Harvard-affiliated hospitals, and I kind of felt like imposter syndrome in those areas.
Oh wow. Yeah.
Yeah.
Okay. Um. Oh wait, we haven't spoken about your experience overseas in medical school. Do you want to touch upon that very quickly?
Yeah, well, overseas in medical school, I went to medical school in Italy, as I said before. It was, first of all, was getting accustomed to the country, the language, and their customs. And kind of medical school was secondary after that. And in most European countries, exams are different, exams are oral, and they're individual. So you may have 300 people in your class, and there's 50 signed up for an exam, and um, 10 will be on the first day, 10 the second day. And when you walk in, you'll sit down in front of 3 professors with your 300 classmates in back of you, and they'll ask you a topic. And you have to basically give them a lecture about it. And then the next person comes in, they're going to get actually 3 questions, which you need to give them a lecture about. And then next person comes in and gets 3 different topics. So, for example, my first year of med school, I was studying with one of person that lived in the same building. We kind of studied together, and he walked in, and we studied everything. And first questions he got asked was something that we went over every day. Every day, the last thing we went over, he got asked that, and we knew everything perfectly except when I sat down, I got asked a question that we didn't even look at.
Oh wow.
I was expected to give a whole lecture there, so
Yeah. It seems very different.
I had to come back 2 months later to do the exam.
So,
okay.
What is one piece of advice you would offer for a pre-med? Very general question, but what would you say?
Establish good study habits. And by what I mean by good study habits, study with intelligence, have a fixed amount of hours you're going to study per day, and put in breaks. So don't sit down, the whole day for 8 hours without taking a break. Okay. And, don't try to catch up on work. So a couple of hours a day during the week, which would be, well, you're needing more than a couple hours a day. But for example, 2 hours a day for the entire week is better than 10 hours all day on Saturday.
Okay. Yeah. I feel like a lot of people in my generation especially, they have this mindset where they call it the locked in mindset, where they really focus in on one day. Like, let's say they pull an all-nighter the night before an exam, then they study for, let's say, 20 hours in that day, an absurd number, right? So
correct.
Yeah, space it out.
That's existed forever. So just maintain consistency, good study habits, and consistency.
Yeah, and the one thing most people don't talk about is if you do study or cram overnight for an exam, you don't actually retain that information over a long period of time, and that's important in medicine. You should be remembering these important concepts. Yeah,
that's a very good point. You're just getting short-term memory there.
Yeah, and now back to the first question where I ask you, why medicine? You could answer it the same way, or you could think about how you answered all these questions and maybe format it a little bit different if you want.
I'll answer probably the same way, but it's medicine is a challenge, and you're constantly engaged, and you want to know why and what's happening. It's the unknown. So here's how people should not answer a question, because people, a typical question back in the day doesn't happen anymore. Why do you want to go into medicine? And people would always say, because I want to help people. And the response from the person interviewing them would always be, well, if you want to help people, join the Peace Corps. So that wasn't a good answer. So need a better answer, like you're looking for me, and I'm probably not giving it to you. But I think it's the challenge and the unknown.
Okay. Yeah. And
And also, I think you're going after a career that it's not, a 9 to 5 job. There's something different, not only every day but every hour.
yeah, medicine is unique in the fact that you said it's unknown. You don't know what
It's
the next case is
unknown.
going to be. Yeah.
Correct.
Yeah.
It's very dynamic.
That that's the very interesting part. That's the one thing
Yeah.
that a lot of people look at. Yeah. And last question. Do you have any thoughts on this podcast or what I could do to improve it, or I don't know, how did you feel about the experience so far?
I think this is a great way to start. It's a great podcast. You have all the right questions. And I did see something on there which I'd like to pass on to everybody else. This speaks about being a pre-med, medical student, residency, and then, getting to your final goal, right?
Yeah.
The journey is better. The journey is far better than the destination. So please enjoy the journey. The studying as a pre-med, enjoy medical school, residency, because once you get, everything is constantly evolving and changing, and you're meeting new people, and you're moving towards the next step, with the next group of people, the next set of endeavors. And then once you get there, it's the same for the rest of your life. And that goes for any field which people are studying. So that's one of my favorite sayings. The journey is far better than the destination. Not that there's nothing wrong with the destination,
Yeah.
but it's please enjoy the journey, because
Okay.
that's what you look back on the most.
All right. Yeah. Thank you. Thank you.
You're welcome.
Thank you for spending the time here, taking the time out of your day to do this podcast. I know we had a brief intermission, I would like to call it,
Yep.
where we had to fix the time, but it's okay.
Not a problem. Okay.
Yeah. Any final words, or do you want your final words to be that enjoy the journey, not the destination? Okay.
Yeah, enjoy the journey.
Enjoy the journey. All right.
Just enjoy the journey.
This is AP Med,
Okay.
and I'm here
Right.
with Dr. Michael Sbarra, who I just interviewed. And one theme I would give from him is that medicine is unknown and unique. So you should enjoy that journey because you don't know what's forthcoming.
That's great. You summed it up wonderfully. That's why you're in the position where you are.
Thank you.
Elected for that
I try my best.
8-year program.
Yeah.
Yeah.
Okay. Yeah. Thank you.
All right.
All right.
Okay.
All right.
Thanks. Take care.
Bye.